Vayah Vikas is going to be by the seniors, of the seniors, and for the seniors. And ultimately, our larger objective is that we form a body which is the voice of senior citizens.
Right. One question I wanted to ask you was, what are the critical gaps in India's elder care ecosystem, and how do you think Vayah Vikas can bridge that gap? Good evening. Today we have Dr. Alexander Thomas with us, who is our founder board member of Vayah Vikas, also head of AHPI and CAHO and a lot more titles, but we'll let the man talk today. So, you have been with Vayah Vikas from day one, and how do you think we have been progressing in the last 3 years?
The last 3 years there's been very good progress, and especially the last couple of years. So I just go back a little bit. The concept of Vayah Vikas was probably more than a decade ago. But then the stars didn't align. It was only when I met Chris and we were together in the think tank at the this National Law School of India University that this evolved, and I think Chris has made it possible to take it forward.
Yeah. One question I wanted to ask you was, what are the critical gaps in India's elder care ecosystem, and how do you think Vayah Vikas can bridge that gap?
See, if you look at the situation in India today, there are a lot of senior citizens, elders, and earlier, maybe a few decades ago, the culture, the joint family took care of it, but today the situation is very, very different. So seniors really don't get the right type of care, the right type of environment that they deserve, and also the regulatory approach is a little fragmented. So I think we need to put everything together, empower the senior citizens, and ensure that the community make sure that senior citizens get a life of dignity and happiness.
Thank you. I think that's very important, that we lead with dignity and purposefulness lives for senior citizens. But there's a lack of training initiatives that we see. There's a lot of gap in that sector. So what training initiatives are essential to prepare healthcare professionals for the unique needs that's going to arise with elder care?
India is a little slow in starting, but sometimes we catch up pretty fast. So what we are doing again through Vayah Vikas and through some of the other organizations, we have actually lobbied with the medical bodies, the National Board of Exams, the National Medical Council, and they've started formal training in geriatrics for medical professionals. Through the Health Sector Skill Council, we are also empowering and skilling workers at the grassroots. Then of course you need counselors, etc. So we are working with a large number of agencies, but it's very important that we scale up quickly. So one of the initiatives we have done, we did this with the Public Health Foundation of India. The number of geriatricians required for the number of senior citizens, to satisfy that, will probably take another 50 to 60 years. Right. So what we have done is with PHFI, we have actually curated a training program where MBBS and GPs are trained. It's a 1-year program with hands-on, and then they go back to the community, and that's worked out very well.
Right. So it's not only health professionals, we need caregivers also to be trained. So how do we bridge that space where we have a lot of caregivers, but we don't have trained caregivers?
So there again, we are using the Health Sector Skill Council, and we have come up with a course. I think Vayah Vikas helped with that, on training, upskilling GDS. So we hope that that will to some extent take care of the problem. But having said that, it's very important that these people have a career graph.
Right.
Because many people burn out working continuously with elder care, and HSSC is trying to address that issue also.
I think that's very important, because they work for 3-4 years. We see a lot of attrition with them because they don't have clear career goals. That needs to be addressed, definitely. Also, how do you think technology can play a role with all these training programs, with all the new technology that's coming up?
I think technology can be used both for training and also to help the senior citizens in their daily lives. We have to ensure that as healthcare professionals, that we don't depend purely on technology.
Right.
We leverage technology to improve the quality of care that we have, and certainly we can also use technology for the safety and ease of doing business for senior citizens. same time being careful that they are also aware about the downside of technology.
Correct. That's a very important point. We need to know the good of the technology as well as what's the bad things that can happen. So, last question to you. What do you see as a long-term vision for Vayah Vikas? How can we play a bigger role in the whole creating the bigger ecosystem that's required in the space?
I think it's very simple. At the end of the day, Vayah Vikas is going to be by the seniors, of the seniors, and for the seniors. And ultimately, our larger objective is that we form a body which is the voice of senior citizens.
Right.
And one of the reasons I've been into this with AHPI, with CAHO, government and other stakeholders listen to you when you're unified. And I'm
Correct.
sure that when we reach 1 million, and we're hoping to reach it in the next 1 year, the politicians also will start listening to us,
Yeah.
and that will help.
I think that's the clear message at the end of the day for us all to carry, that when we come together and become one voice, everybody will listen and bring about the changes that is required. Thank you so much
Thank you,
for your
my
time
pleasure.
today.